Yo guys, welcome to our video. It's my beautiful cup there, showing that we are going to enjoy our video today. It's my lemon water actually. I think I love the cup. You can tell me how you find it. Yeah, I love that kind of drawing there. Yeah, so I think some birds here, also some tree here. I like the design of that cup. Guys, the channel is Future Talks. Kindly, if you have not subscribed, subscribe to our channel. This is where we get to explain matters which look complicated in a very simple language that each one of us can understand, especially in very difficult topics in the medical field, but which are very vital in our life, and also we get to meet them in everyday life in our life. Today we're going to talk about a topic which is very important, and we're going to talk about DIC. DIC is what you call disseminated intravascular coagulation. In short, it's called DIC, disseminated intravascular coagulation. So that's our topic today. And it's a very common cause of death in many patients, especially even at home and in an hospital setting. But most of the time it goes unnoticed, or it is realized when it is too late. So that's why I feel we should share something on this DIC, or disseminated intravascular coagulation, which is a very common diagnosis which patients come with in an hospital setting, and we're going to look about it, what it means, and also it presents itself, how it can be treated, which drugs can be used to treat it, so that it doesn't get into a complicated situation. So guys, welcome. Future Talks is your channel. My name is Vincent. Kindly, if you have not subscribed, subscribe to our channel. And for any support for the channel, it is up on the details of our channel. Kindly, you can always find us there. And also give us a nice comment down there. And also give a like for the video, because that is the best way you can always recommend us for other viewership, and also for other prescription, and also subscription to our channel. So disseminated intravascular coagulation is a serious medical condition which is characterized by the widespread activation of blood clotting factors throughout the body, so leading to the formation of blood clots in the small blood vessels. This process can lead to dysfunctional organ dysfunction or organ failure. And when we talk about organs, we mean our body has organs like the kidneys, we have the heart, we have the lungs, and also we also have the brain as a body organ. So when we have DIC, or we have disseminated intravascular coagulation, we have because of the clotting of blood in the body, which is very abnormal, it leads to occlusion, or they get to close the small vessels in the body, and that is now what you call DIC. So DIC can occur as a complication of various medical conditions. Number one cause of DIC is what we call sepsis. Number two is trauma due to accident or due to some surgery, especially certain medical procedures, especially the surgeries, can predispose a patient to DIC. So the condition is characterized by the formation of blood clots that can consume the body's clotting factors. We know when you are cut, or normally if I cut myself with a knife or a sharp object, you are supposed to bleed a bit, and also so the body works on a clotting process, where now the blood stops coming out, because there's a special plug which forms to prevent further bleeding, and that's how normally the body works. But during DIC, we have overbleeding of the body and the misuse of the clotting process in the body. So we get that now the body has a challenge to manage that one. So because of the consuming of a lot of blood of the body clotting factors, so we have a lot of we have now failure of the organs, because now we have insufficient blood flowing to the vital organs, and now we get a problem there. So normally, the causes of the DIC, number one is sepsis, as I have said. That's the most common cause of the sepsis. And in severe bacterial infection that can cause inflammation throughout the body and lead to abnormal clotting of the in the body. So, and also when we have especially cancers, some types of cancer, particularly those that involve the blood or bone marrow. We know the red blood cells and also some clotting factors that are produced through the bone, through the bones. And if we have cancer affecting their production, so one is likely to develop what we call DIC, or we can trigger DIC. Trauma, severe trauma such as a car accident or a major surgery can activate the clotting system and lead to DIC. Another cause is obstetric complications, especially in women during pregnancy or during the childbirth, particularly in cases of severe what we call preeclampsia. Preeclampsia means we have high blood pressure during pregnancy, which sometimes can lead also to convulsions. So that one can also cause DIC. And also what we call placenta abruption, or when the placenta disengages from the wall of the uterus before the child is born. And now that one also can lead to what we call DIC. Liver diseases like the what you call liver cirrhosis and other conditions can also cause DIC. Also, some snake bites. Certain venomous snake bites can trigger what you call DIC because of the kind of poison which is in that snake bite. So one can develop DIC, and that is a form that's the snakes which use that special way where they deactivate the body clotting system, so where one gets to bleed to death. Also, transfusion reactions. That's in rare cases, transfusion reactions can cause DIC. And also, certain medications such as chemotherapy drugs or antibiotics can increase the risk of DIC. By chemotherapy drugs, we mean those drugs which treat cancer in the body. It can also predispose one to get into the problem of DIC. That's why it is always good to monitor. So guys, I'm taking my lemon water here. So also certain medications, I have said about the chemotherapy drugs and also some antibiotics can predispose one to that problems. Guys, welcome to our video, and also kindly, if you have not subscribed, it's high time you subscribe. I'm giving you 1 minute, 2 minutes there so that you can subscribe. So as much as I can explain about DIC, is a very complex kind of development, and there may be multiple factors triggering the condition. So it is important always, especially for the doctors and also the healthcare providers, to determine the cause and properly manage the condition, because it is not a walk in the park when it is with the patient. It's something which needs uh, a very fast kind of approach, so that one gets to prevent it in or manage it in a very faster way. So in management of DIC, or disseminated intravascular coagulation, it depends on the underlying cause and the severity of the condition. So in the management, the goal or what is supposed to be done, or what is supposed to be the back of mind of whoever is managing the patient on this DIC thing, is about preventing further clotting and also manage the bleeding complications. So number one is about treating the underlying condition and the management. So if the patient has sepsis, there are very specific antibiotics which can treat that kind of condition in that patient. So it's important, for example, if this is caused by sepsis, underlying condition should be treated by antibiotics. Number two is about blood transfusion. Is also a very vital management, especially depending on the severity of the condition. Patient may need an urgent transfusion, so it is very important, and also it's a very good practice that when a patient is started on management, or the patient is on maybe surgery, that the patient gets proper management, and also the blood gets to be available for the same. And during transfusion, the red blood cells can be transfused, the platelets can be transfused, and also the clotting factors can also be introduced to help the control the bleeding. So that patient is highly monitored, so that to find where the problem is and also approach it as appropriate. Also, anticoagulants can be given. In some cases, anticoagulants such as the heparin may be used to prevent further blood clotting, so that the patient doesn't bleed a lot. Also, oxygen therapy in severe cases, especially in a theater setting or in a CU setting, the patient is put on oxygen therapy, so that to improve the breathing and oxygen delivery to the body tissues. Also, we have what you call supportive care. The patient with DIC requires supportive care. That's why the patient needs to be in an ICU or high dependence unit to manage the condition as appropriate. So things like also kidney dialysis, that's in the renal unit, is done at that particular level, and also the medications, especially to manage the pain, because the patient gets to experience a lot of pain at that level, so that and also other drugs as appropriate to manage other symptoms. That's why the doctor, also the healthcare provider, needs to be there, the renal nurse, and also the ICU team to manage that patient as appropriate. So also there is is a very, as I said, is a very complex development, but the management of the AC can be complex and requires close monitoring and also management by the healthcare team. The specific treatment plan will help on underlying cause of the condition and the patient's individual medical history on the overall health. So history for the patient is very important to determine, especially doing a complete blood count for the patient, and also to determine what is happening really, especially if you're the patient's for surgery and somebody has done the platelets and the platelets look low, so one is prepared for patient not to have that bleeding tendency, which can lead to a lot of complications. So we have examples of the drugs which are used in management of DIC, or disseminated intravascular coagulation. So depending on the underlying cause, heparin is a type of anticoagulant which is used to prevent the formation of blood clots in the patients with DIC. We have fibrinolytic agents such as tissue plasminogen activator, or TPA, which is used, which can help to dissolve blood clots that have formed already. So we have fibrinolytic agents such as plasminogen activator, or TPA, which is used to dissolve the clots which are already formed in the body. We have also pro agents like procoagulant agents like recombinant activator factor, that's number 6, or RF6A, which can be used to increase the recombinant activator, which can also help in the increasing the clotting factor, which is always in the body, but because of the compromisation which has happened, so these procoagulant agents is introduced to especially attack the severity in the severe bleeding due to DIC. Also, blood transfusion through the red blood cell transfusion is introduced to treat anemia caused by the bleeding. Also, what you call precipitates is a blood product that can contain clotting factors, so which can be used to treat the blood in patients with DIC. So cryoprecipitate is very important also. It helps to contain blood clotting factors that can be used to treat the bleeding in the patients. Also, we have antibiotics which can be used to treat bacterial infection, which can cause the bacterial infection that can cause the DIC. So the specific drug used in management of DIC will depend on the underlying cause and the patient's individual medical history and overall health. So it is important to work closely with a health team to determine the appropriate treatment plan and also in the management. So DIC is a very serious condition which needs to be managed in a well-controlled situation, and that is most likely in the hospital setting, so that to determine the cause and also treat it appropriately, and a decision needs to be made as fast as possible so that to prevent further clotting and also the occlusion of the smaller the vascularization of the body, so that the patient gets to a safer area, or we get to save the life of the patient. So, on the matters of how can we prevent DIC? On prevention of the DIC, or prevention of disseminated intravascular coagulation, it can be very challenging because sometimes it comes without any prediction. So, and it comes as a complication of a certain thing. Sometimes it may come as a history of the patient, and it may not be most of the time it's not in the history of the patient. So it's often a complication of an underlying medical condition or a disease. However, some steps can be taken to help reduce the risk of developing DIC. How can we prevent DIC? As much as we can't really avoid it. So treating the underlying conditions, like I said, if it's sepsis, let the patient get into antibiotics as appropriate to treat the condition. If the patient has cancer of the bones and also of the blood, it should be treated as much as appropriate. So treating the conditions promptly, effectively can reduce the risk of the DIC. Also, very important, this is a very vital thing to do as a healthcare provider, monitoring high risk patients. The patients should be, especially the mothers who are pregnant and also who are exposed to what you call preeclampsia, should be really be monitored during the antenatal and also during the delivery and also post delivery, to monitor for any signs of that DIC. Well, the same thing with patients with the cancers should be monitored closely to monitor for any bleeding tendencies and also the reduction in the blood system of the platelets and also the clotting factors, so that to give the proper approach to it, so that we can do away with the underlying condition. Monitoring high risk patients is very important, especially for the cancer, sepsis, for the trauma patients, should be closely monitored for signs and symptoms of DIC, such as the bleeding tendencies and also abnormal clotting. Also, as a prevention as a prevention thing, blood transfusion is also very important in cases of severe bleeding or thrombocytopenia, or that is when we have low blood platelets. Sometimes the patient gets to be replaced with the platelets, so that the prompt blood transfusion may be necessary to prevent the development of the DIC. Also, very important is about avoiding unnecessary procedures, especially the invasive, sorry for that, especially the invasive procedures such as surgeries or catheterization can increase the risk of DIC. Therefore, they should be only performed when very necessary. So, invasive procedures, as much as possible, should be limited to avoid unnecessary procedures on the patients, which can predispose them uh, to to DIC, especially those patients who are at high risk of bleeding a lot. Also, about prophylactic anticoagulation. Prophylactic, by talking about prophylactic, we are meaning about the prevention of coagulation. So, heparin can be considered for in high risk patients, such as those with cancer or after surgery, to prevent the development of blood clots and subsequent DIC, especially the patients who are surgery exposed, especially post surgery. That's why ambulation or the patient is advised to get out of bed and do some walking post surgery as appropriate, so that to make sure circulation of the body is well, and also to avoid coagulation problems at some point. Also very important because early recognition and treatment is very important on DIC. So because as much as DIC can be treated, when noted late, it is now the outcome is not very good most of the time. So early recognition and treatment is very important. When the medical team one detected this, it is good to always synchronize with the others so that you approach it as appropriate. So, in treatment should be initiated promptly to prevent complication. So, it is important to note that preventing DIC can be challenging, and in many cases, it is a complication of an underlying medical condition. Therefore, the best way to prevent DIC is to manage the underlying condition effectively and also promptly. So, how can one make a diagnosis of DIC? DIC involves combination of clinical evaluation through the laboratory testing and imaging studies. So, the diagnostic criteria for DIC may vary slightly depending on the specific scoring system used by the but generally include the following. So these are some of the ways you can make a diagnosis for DIC. So on clinical evaluation, DIC should be suspected in the patient with history of underlying medical condition or event that may predispose them to development of the DIC, such as the patient with sepsis, patient with trauma, especially the accident patients, or patients undergoing surgery, also cancer patients. So, clinical signs and symptoms of DIC may include bleeding, thrombosis, organ dysfunction, and also the fever. So, also that's on the clinical evaluation. On the laboratory testing, on the laboratory tests used to evaluate, it's used to evaluate the coagulation system, especially when concerned with the thrombocytopenia, that's the low platelets, to help diagnose the DIC. So the testing may include the CBC or the complete blood count. Here in Africa, we call it full hemogram, where we had to check the platelets, the red blood cells, the white blood cells, and other factors in the blood. So coagulation studies also like prothrombin time. That is the time. That is where now we forget to find the details on how the patient, how long the patient takes to clot, or the blood of the patient takes to clot through the prothrombin time. Also, activated partial thromboplastin time, and also fibrinogen levels, also checking on the clotting factors in the body. Also very important, so like I've said, platelet count in the lab, and also what we call the dimer levels is also done. A high the dimer level suggests that there is ongoing fibrinolysis, and this is which may be a sign of DIC. So the dimers are also very important, and they are done in the lab to make that DIC diagnosis, to make proper intervention and in time. On imaging studies, we have to evaluate the thrombosis and also organ dysfunction associated with the DIC, and this can be done on with ultrasound, and also CT scan also can be done, or the MRI, magnetic resonance imaging, the MRI can be done, or echocardiograph can also give an indication of this diagnosis of the DIC. Also, we have the scoring system which can be done. Several scoring systems have been developed to help diagnose and stratify the severity of DIC, but the most common used scoring system are the International Society on Thrombosis and Hemostasis, or ICTH, and this is a Japanese Ministry of Health, and also Japanese Health and Welfare, or JMHW criteria which can be used. These are now these are for healthcare providers. I've talked about International Society on Thrombosis and Hemostasis, or ICTH, or the Japanese Ministry of Health and Welfare, that is JMHW criteria. There's a special way the patient is scored to determine if the patient has developed the DIC. So the diagnosis of DIC can be challenging because of it often occurs as a complication of underlying medical condition. Therefore, it is important to work closely and with the healthcare team to provide thorough evaluation and determine the appropriate diagnostic tests and also treatment plan. So it is always good to sensitize everyone on the healthcare team to to make early to make a proper diagnosis at appropriate time, because the late diagnosis will not be of really help to the patient. So we have symptoms of DIC. How do you know a patient has developed DIC? Uh, like I've said, DIC is a very serious medical condition and can present with a wide range of symptoms. The symptoms of DIC can vary depending on the underlying cause, and the severity also can be of the condition of the organs affected, can also be exhibited. But some common conditions, some common signs and symptoms for this. Number one is about bleeding and abdominal bleeding from the patient. This may include from the gums, from the nose, bruising easily, and excessive bleeding from the cuts. It can be a sign of DIC. Also, blood clots. DIC can lead to formation of blood clots, which can block blood flow to the vital organs, as I've said, and this can cause organ failure. So, blood clots can occur in the lungs, legs, brain, and may cause symptoms such as shortness of breath, chest pain, leg pain, and also confusion. Also, low blood pressure, as when you are monitoring your patient and you find that the pressure is going really down, this can damage vital organs such as the liver, kidneys, and also lungs, leading to symptoms such as abdominal pain, jaundice, difficulty in breathing, and also decreased urine output. So fever is also another symptom. So patients with DIC can develop fever, which can be a sign of infection or an inflammation. Also, it is important to know that the DIC can be a life-threatening condition and may present with non-specific symptoms. Therefore, any patient with a history of an underlying medical condition which can predispose them to DIC should seek medical or immediate medical attention to prevent further complications. So, DIC, or disseminated intravascular coagulation, is a very serious condition and can lead to a variety of complications. So, I'm going to share some of the few complications which can come about with DIC. Number one is about organ failure. DIC can cause damage to multiple organs, including the kidney, liver, lungs, brain, and this can lead to organ failure and life-threatening complications, or it can lead to death. Number two is about bleeding as a complication of DIC. because DIC can cause abnormal bleeding, which can range from minor bruising to life-threatening hemorrhage. In severe cases, DIC can lead to massive bleeding that is difficulty to control. Also, we have blood clots. Although DIC is often associated with bleeding, it also can cause the formation of blood clots in the small vessels, which can lead to ischemia and also organ damage. And also, as a complication, it can lead to shock. DIC can cause a drop in the blood pressure, which can lead to shock, life-threatening condition, in which the body vital organs are now deprived of oxygen and nutrients. And lastly but not least, and that is not what you want, it can cause death. If left untreated, DIC can be fatal. So the risk of complications is highest in patients with severe or prolonged DIC, those with underlying medical conditions and who do not receive prompt and appropriate treatment. Therefore, it is important to seek medical attention if you have any symptoms of DIC or a history of underlying medical condition that may predispose you to DIC. So guys, disseminated intravascular coagulation is a serious medical condition that can have variety of causes, including infection, trauma, cancer, and pregnancy. It is characterized by abnormal blood clotting and bleeding, and can lead to organ damage and failure if left untreated. So guys, prompt diagnosis and treatment are essential to prevent complications and improve the outcomes. Treatment options for DIC may include the underlying cause, supportive care, and medications to manage the bleeding and blood clotting. If you suspect that you have DIC or at risk of the condition, it is important, guys, to seek medical attention immediately so that we don't get into complication. Guys, the channel is Future Talks. Kindly, if you have not subscribed, subscribe to our channel. My name is Vincent, and I also want to welcome you to our next video. Thank you, guys, and also keep in the channel. More is coming. Guys, welcome to our next video. Thank you very much.